My name is Dr. Shahid. I'm a general pediatrician and medical educator, and we've been talking about emotional intelligence. This is part two of that talk. So hopefully you've already watched part one and have a background of emotional intelligence. And now we're going to continue our discussion and just dive right into it and do part two of our video lecture here. So in the first part, in part one of the video, we talked about self-awareness and self-management. And in the second video, we're going to be talking about social awareness and social skill or relationship management. So we said self-awareness was being aware of your emotions and how they affect you and others around you. Self-management, we said, was being able to manage and control your emotions. And now we're going to talk about social awareness, which is being aware of how you socially interact with others and how you are perceived by others. And then we're going to talk about social skill, which is the ability to build strong relationships with other people. So let's talk about social awareness, and then we'll talk about social skill. So social awareness is your ability to accurately pick up emotions in other people and understand what is really going on with them. It is perceiving what other people are thinking and feeling based on their emotions, tone of voice, choice of words, facial expression, and body language. So what does that mean? That means that you are able to really read the other person, right? You're picking up on their nonverbal cues and their body language, and you are reading the other person. You are kind of reading your audience, right? You are kind of reading the room as you are interacting with people around you then, right? So again, social awareness is being able to pick up on the body language and nonverbal cues of the other person and kind of understand what's happening with them as you interact with them. But social awareness goes in both directions. So it's not just you perceiving them, it's how are they perceiving you. So being aware of the fact that you are being perceived by others and understanding how they see you in that interaction. So it's being aware of how your words or actions are being perceived, or maybe even being misperceived. It's being aware of the perception you give and how it can be very different than what you had intended. So it's being aware of your nonverbal cues and body language. So it's being aware of what message are you sending through your body language and your non-verbal cues, and what impression are you giving other people? What perception are you giving to other people? That's part of social awareness. So we really have to understand that. I think this is a very important slide, basically talking about different elements of our personal communication. And what they found is that our spoken words only make up 7% of our personal communication. 38% of our communication is based on our voice and the tone of voice that we use. And 55% of our communication is actually through our body language and on non-verbal cues. So it is so important. More than half of our personal communication is done by our body language and non-verbal cues. So it is so important to be aware of how you are interacting with others, how you are standing, how you might be posturing. Are your arms crossed? Are they straight? Are you rolling your eyes? Are you smiling? Do you look annoyed? Do you look angry? So your body language and your nonverbal cues are so important, and that is an important aspect of social awareness and emotional intelligence to keep in mind then. So what are some qualities of a person with emotional intelligence and social awareness particularly? They include the quality of listening, respect, service or selflessness, and empathy. And we're going to talk about each one of these briefly. So empathy, let's start with that. So empathy is the skill at sensing other people's emotions and understanding their perspective and taking an active interest in their concerns. So as healthcare providers, as medical students, as residents, as house staff, as practicing physicians, we get some training on empathy, and it's being able to, again, relate with your patient and understand their perspective and take an active interest in their concerns and their needs and to help them. So this is something that we try to be good at, but it is very important as a healthcare provider, and especially also as a leader of a healthcare team to be able to have empathy and kind of put yourself in their shoes and see it from their perspective. So that's an important skill to have, which is part of social awareness and emotional intelligence. So the next quality of a person with good social awareness skills include listening, right? So listening and observing are the most important elements of social awareness. You have to stop talking, stop anticipating the point the other person is about to make, stop thinking ahead to what we are going to say next. You just have to stop and listen. That is so hard to do. right? When someone is talking to us, we are not really listening to them, right? We're they're talking to us and we're thinking about, okay, why are they saying this? Where are they going with this? And they have no right to say that to me. And we're waiting for a pause so we can interject and we can clarify the situation because they clearly don't understand what they're talking about, right? So we don't listen very well, right? And we're not really listening to when somebody is talking to us. And in fact, studies show for physicians actually are not very good at listening, right? When you look at the different studies about how long it takes a physician to interrupt the patient as they are telling their story, right? On average, it's like 12 to 18 seconds, right? Some studies say maybe 30 seconds, but it's not very long for a physician to stop listening and interrupt the patient as they tell their story. Most studies say like 12 to 18 seconds. So we are not very good at listening. So so we need to be better at that. And that is a very important skill related to emotional intelligence and social awareness. So empathic listening is the skill of extending yourself for others by really working to see it as they see it and feel it as they feel it. And empathic listening is one of the best ways to build trust with another person, right? So as a healthcare provider, empathic listening is one of the best ways to build a relationship with your patient, to build rapport with your patient, to build trust with your patient, right? So really listening to them and really working to see it from their perspective. That's such an important aspect of being a physician that we have to keep in mind. So one of the most powerful dynamics of human interaction is when people feel as though they have been heard. Hearing someone does not mean you have to agree with what was said. Rather, it is working to understand where people are coming from. So again, listening to other people is so important, right? Sometimes, people just want to vent. They're frustrated, right? And they just want to be heard, right? So they just kind of want to vent their frustration. They don't want you to necessarily do anything about it, but they just want to vent a little bit and to acknowledge their frustration, right? And just having people feel as though they've been heard can really make a really big difference in your relationship with that person, especially if you're the leader of a team. To allow people on your team to voice their opinions and feel as they've been heard, and to acknowledge that and to recognize that and try to improve on that is very, very important. So this again is listening is such an important aspect of emotional intelligence and social awareness that we have to get better at. Then, okay, another quality of a person with social awareness includes respect. What does that mean? That means treating people like they are important, right? So that means that you value the contribution of everyone around you. You value the contribution that everyone is making as part of the healthcare team, right? You value their contribution. You value their input. You value their opinion, right? You value the work that they do as part of the healthcare team, and you respect them for what they do and the contribution that they make to the team. That is such an important aspect of social awareness and emotional intelligence, and that's such a great way to build a strong relationship with others around you. When you make them feel important, when you make them feel valued, when you make them feel that their contribution is significant, that creates a great relationship with you and that other person. So again, as a leader, especially of a leader of a healthcare team, leader in any way, to respect everyone around you and treat them for the value that they bring to the team is so important to develop that strong relationship with them. And the other thing to remember is that you don't go around looking for respect. You look for ways to give respect to others, right? You don't go around saying, okay, I'm the doctor, so now you have to respect me, right? It doesn't work that way. You have to show respect to others and give them respect, and they will give you that respect back, and you'll get that respect back then, right? So I think that's an important aspect to keep in mind related to respect. Okay, so I want to share a little scenario or a little story that this author shared in his book. John Maxwell has written several books on leadership, and in this one book called "The 21 Indispensable Qualities of a Leader," he talks about respect. He doesn't talk about it as one of the 21 qualities. It's under another quality in one of those chapters, but he talks about respect, and he talks about a woman that has dinner with two different leaders, two different statesmen, and she has a very different feeling after having dinner with each of these statesmen. So he says in his book that a woman dined with two different statesmen and said, "When I left the dining room after sitting next to Mr. Gladstone, I thought he was the cleverest man in England." Right? So she has dinner with Mr. Gladstone, and he talks about the things he's done in his career, right? And she walks away just amazed with all the achievements that he's done in his career, all his accomplishments, all his achievements, all the things he's done. And she gets up and leaves and thinks to herself, my gosh, this is the smartest person I've ever met, right? And then she has dinner with a different statesman. And she has a very different feeling after having dinner with the other statesman. It says, but after sitting next to Mr. Disraeli, I thought I was the cleverest woman in England. A very different feeling, right? Why? Because Mr. Disraeli didn't talk about himself. He wanted to know more about her. He talked about her. He made her feel special. He made her feel important. He respected what she had done, right? So he wanted to know about her achievements and her accomplishments, right? So then when she gets up, she has this feeling when she leaves Mr. Disraeli, right? So very, very different type of feeling, right? When she leaves Mr. Gladstone, she has the utmost respect for him. When she leaves Mr. Disraeli, she has the utmost respect for herself, right? So again, so important to respect other people and to talk about them and to understand them and to make them feel special and important, right? And that again creates such a special relationship between you and the other person. And again, that's what emotional intelligence is all about: is building strong relationships with other people, and respecting other people in that way helps you develop that strong relationship with them. Another aspect of respect is that you choose to treat all people in a kind and respectful manner, even when they behave poorly or quote don't deserve it, right? There's always times where we interact with someone and then we walk away and say, you know, they had no right to say that to me, right? That wasn't fair. They should not have treated me that way, right? But the next time you see that person, you still treat them with kindness and respect and courtesy, right? You don't stoop down to their level. You take the high road, and you are always respectful to that other person. Because again, as the quote says here, respect for people is the secret ingredient of a successful team. So always respect others when you're interacting with them. Okay, let's briefly talk about selflessness as a quality of a person with social awareness. So this is when you think about others and their concerns before you think of yourself, and that can be also called servanthood. So servanthood is the ability to put others ahead of yourself and your personal desires, and it's being able to perform small acts of kindness that help others and serve others. Now, you know, we in healthcare, we do this all the time, right? For our patients, you know, we put their needs ahead of our own needs. We're always serving them, doing small acts of kindness for our patients, but we need to do this also for ourselves and for our teammates as well, because that makes a huge difference in interacting with your teammates as well. Okay, so now let's talk about the fourth component, final component, emotional intelligence, which is social skill. And again, we said this is the ability to be able to develop strong relationships with other people. And this, again, really is the goal of emotional intelligence, is to build strong relationships with other people, whether, again, you're a healthcare provider and you're doing that for your patient, or you're in some leadership role and you're working with your team. It is so important. Again, that's the goal of emotional intelligence, to build strong relationships with others, to work effectively with your team. So it's your ability to use your awareness of your emotions and those of others to manage interactions successfully. So people with good social skills, with good emotional intelligence, have mastered their ability to communicate effectively, to build bonds, and to build relationships, and to work as a team through collaboration and cooperation. So again, this is the goal of emotional intelligence. This is the goal of effective leadership. This is the goal of a team, right? To communicate well, to build good bonds and relationships, and to work together as a team. So again, this is the goal of emotional intelligence: to interact with people in a positive way, in a way that affects them in a positive way. Again, that's the goal of emotional intelligence. So what are some qualities of a person with good social skills? Those can include kindness, generosity, forgiveness, and developing others. So let's maybe briefly talk about a couple of these. So kindness. Kindness is appreciating others, giving praise and credit to others, doing the little things like saying please and thank you, or saying I'm sorry, I was wrong when you make a mistake, right? So I think this is a very important aspect of emotional intelligence in working with others, in building strong relationships with others, especially if you're the leader of that team, is so important then, right? So again, these go such a long way in building a strong relationship with other people, right? When you appreciate them, right? When you give them praise and you give them credit and you thank them for the contribution they are making, right? And you show them that kindness, that goes such a long way in developing a positive relationship with that person and with everyone else around you. So I think there's a very important aspect of emotional intelligence and interactions and strong relationships. So again, the kindness can include doing little things like being the first one to say good morning in the hallway, doing the little things like smiling when you meet someone, right? And doing simple acts of kindness, right? So again, showing up to work and smiling at everyone, saying good morning at everyone, right? And showing up in a good mood and being positive and upbeat, right? That's so important for the morale of the team, especially if you're the leader of that team, then, right? And doing simple acts of kindness. So, right, let's say you had a rough day. Your team had a rough day yesterday, and they got through it. They worked together. So the next day, you bring in some treats for them. You bring in some candy or some donuts or something to celebrate the fact that you got through that difficult day together as a team, and everybody contributed. And that simple act of kindness can make a huge difference, right? Especially if you're the leader of that team, to do that simple act of kindness, to show your support of the team, and and your consideration of the team, and that you really value the team spirit and things, right? And you don't have to be the leader, official leader, to do these acts of kindness. Anybody on the team can bring in something and show an act of kindness to celebrate the success where everybody worked hard and got through with that. So I think that's a very important aspect. Again, it really builds strong relationships amongst the team when these acts of kindness, and again, just showing up to work, smiling and in a good mood and saying good morning, where he makes a huge impact on everyone else around you and builds strong relationships with them. Okay, another quality of a person with social skills includes being generous, right? The thing with generosity is that you have to be satisfied and content with what you have in order to be generous, right? Because it's hard to be generous if you're not satisfied with what you have. You have to be grateful and thankful for what you have, because generosity arises out of contentment. Sometimes the problem we have is that we are so caught up in our own circumstance. We're always complaining about things that we forget to be grateful and thankful for what we have, including the people that we have in our lives. And we're so caught up and complaining about things that we're not grateful and thankful. And there's no way we're going to be generous with our time and our resources and our money and our energy and our skills and our talents. And we're not going to share that with anyone because we're so caught up with complaining about things. So we have to learn to move beyond that, be generous with the resources that we have then. Okay, so this is an overview of emotional intelligence, how I like to think of it. We talked about the 4 areas of emotional intelligence: the self-awareness, the self-management, the social awareness, and social skill. And again, we had talked about self-awareness and self-management in the first part of the video, in part 1, in a separate video. And today we talked about social awareness and the social skill. And these are some of the qualities that I think are important in each one of these areas of emotional intelligence. So I think a couple that I didn't really talk about was forgiveness and developing others, and just a brief word about that. So forgiveness is when someone makes a mistake, you forgive them, right? Doesn't mean that you necessarily let them get away with it, right? You still kind of, if you need to hold them accountable and reprimand them or whatever, you do that, right? But then after that, you forgive them. Meaning what? Meaning you don't hold a grudge against that other person. Meaning that you are not resentful toward that other person, right? But you forgive and you forget and you move on, and you don't hold a grudge against that person. That's part of forgiveness. Developing others. This is such a great way to develop a strong relationship with another person. When you develop them, when you mentor them, when you help them grow, that creates such a special bond and relationship with that other person. And again, emotional intelligence is all about developing strong relationships with other people. So again, just a brief word on those 2 that we didn't really talk about. So now I think it's important to kind of reflect on all of these areas of emotional intelligence and all these qualities related to emotional intelligence. So I think it's important as part of self-reflection to look at these qualities. And in order to improve emotional intelligence skills, I think it's important to identify 1 or 2 things that you are already good at, and do more of those 1 or 2 things. And that will help increase your emotional intelligence level, right? So let's say you are a good listener and you show empathy toward others, right? So do more of that. And if you do more of that, that will increase your emotional intelligence level, right? And then identify 1 or 2 things that maybe you're not so good at, and try to work on those things. And that will also help improve your emotional intelligence level, right? So again, let's say maybe you get upset, right? And you're not as patient and don't have as much self-control, right? Or you are resentful and hold grudges against others, you don't forgive them, right? So identify one or two things that maybe you're not so good at and try to work on those and then try to improve those. And that will increase your emotional intelligence level. So identify one or two things that you're good at and do more of those things. Identify one or two things that maybe you're not so good at and try to work on those things. And all that will help increase and improve your emotional intelligence level then. Okay, so as we kind of get to the end here, this is a quote that I think is very important. It says, "Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around." And this, again, is a summary of emotional intelligence. Emotional intelligence is having the intelligence to know that you have the potential to turn the life around of another person and have an impact, a positive impact on another person through your interactions with them, and making sure that all your interactions are positive. So that little touch, that little smile, that kind word, that listening ear, right? That praise and compliment, that small act of caring, right? Can make a huge difference in the life of another person, especially when you're a healthcare provider, right? When you're interacting with your patients, that's an opportunity to make a difference in the life of that patient. We have that special privilege as healthcare providers and that opportunity to potentially change the life of another person, right? And that's what emotional intelligence is all about, is recognizing that you can make a positive impact in the life of another person. Again, whether it's your patient, whether it's a team member, whether it's a friend, a colleague, a coworker, a family member, whatever aspect it is, use emotional intelligence skills to be able to build strong relationships with other people and to be able to impact them in a positive way. And I think that is so important to keep in mind in every aspect of our lives. And I kind of want to end with kind of a personal story. I was asked to give a similar lecture to this one on emotional intelligence in New York City a year or two ago at a large federally qualified health center. And they invited me to speak on emotional intelligence. They had seen some of the research and other work that I've been able to do in emotional intelligence, and they invited me to speak on the topic. So I went out there, and basically what they were doing, it's a large FQHC, and it's a multi-specialty group, and they have about 100 physicians, and they get together every year to celebrate National Doctors Day. National Doctors Day in the U.S. is March 30th, and in this large FQHC, these 100 physicians in different specialties, they all work at multiple offices, multiple clinics throughout New York City. They get together once a year on Doctor's Day, and they have dinner together. They see each other, they socialize, and then they invite a guest speaker as part of that event. So they had invited me a couple of years ago to talk about emotional intelligence as the guest speaker to their annual celebration of National Doctor's Day. So I go there and I give this similar type of talk on emotional intelligence, and I'm there, and there's about 100 people in the room, and I'm giving this talk. And I noticed this one woman sitting in the audience, kind of near the front, and I can see that she is totally into my talk. Right, I'm talking about emotional intelligence, and I'm using my emotional intelligence to read her body language, right, and read her nonverbal cues, right, because I can see she's making eye contact with me, she's smiling, she's nodding, she's laughing at my jokes, she's really into my talk, right. So I give my talk, and then we break and we have dinner. Then we come back, and then they have some time where they do different awards, and they recognize different physicians for these different awards. And there's one award called the Patient Choice Award, in which one of the physicians is being recognized by a patient for the work that they've done and the care they provided for this patient. So it's time for the Patient Choice Award, and they ask the patient to come and present the award to their doctor. So it's time to present the award, and this woman that was in the audience that was totally into my talk, she's the patient now that is going to come up now to present the award. So they asked her to come up to present the award to her physician. And so she's kind of a woman maybe in her 50s, kind of thin, kind of frail. She walks up and she starts to talk about her doctor, and let's say the name was Dr. Smith, right? So she says, I want to give this Patient Choice Award to Dr. Smith because Dr. Smith is such a great doctor. Dr. Smith helped me when I needed the most help, right? And she goes and talks about her story, and she says about herself as the patient. She says, I was for many years I was on the streets. I was using drugs. I was homeless, and I wanted to get some help. And every doctor I went to, they dismissed me as drug seeking and didn't want to help me. But Dr. Smith, she is such a special doctor because she didn't do that to me. She listened to me, right? She helped me. She really took care of me. And because of Dr. Smith, this patient goes on to tell her story, and she says that because of Dr. Smith, I'm off the streets now. I've turned my life around, and I'm going back to school now. And she tells a great story, and she says, I want to present this award to Dr. Smith because she helped me turn my life around, right? And then she says something really interesting. And then she says, you know what makes Dr. Smith special? And she looks right at me and says, because she has emotional intelligence, right? This patient recognized what made her doctor special was that her doctor had emotional intelligence. She had listened to my talk, the patient listened to my talk, and then she realized that, wow, what makes Dr. Smith special is emotional intelligence, right? Maybe she, the patient had not identified emotional intelligence as that skill before, and maybe she was thinking of it as like bedside manner or rapport or whatever it might be. But now she labeled it as emotional intelligence, right? Because Dr. Smith listened to her, right? Cared for her, didn't dismiss her, right? Had these small acts of kindness that really made a difference to turn the life around of that person, right? And that was a quote that we just looked at previously. That's the potential that emotional intelligence has and our interactions have with other people. And this patient identified Dr. Smith as a special doctor, as a great doctor because of Dr. Smith's emotional intelligence skills. So I think that was really important for me to hear. And it really validates that patients know when their doctor has emotional intelligence skills. Patients recognize that, right? They might call it empathy, they might call it bedside manner, they might call it rapport, but I call it emotional intelligence. And this woman, this patient at that moment, validated that and said, yes, that was emotional intelligence, and that's what makes Dr. Smith special. So I think it is so important to keep that in mind, that emotional intelligence is such an important aspect of developing rapport and relationships with our patients, with our team members, with everyone that we interact with. And I really think the difference between a good doctor and a great doctor are emotional intelligence skills. So these are skills that everyone needs to work on. As medical students, as house staff, as residents, as practicing physicians, we all need to continue to work on that. I'm continuing to work on that. We all need to continue to work on our emotional intelligence skills because that they are so important in developing relationships with other people and to allow you to have a positive impact in your interaction with other people. So with that, I want to conclude with, again, my references. These are some of the references that I've used in this lecture and in part one of the lecture as well. So hopefully you found this helpful and beneficial. I want to thank you for viewing part two of the lecture, and hopefully you enjoyed part one in the separate video, and then this part two as well. And now hopefully you understand emotional intelligence and are willing to work on it and improve it so you can become a better physician and a better professional, and use in your professional life and also in your personal life as you interact with other people and build strong relationships with them. Thank you.